name is Dr. Taiwo William, a consultant obstetrician and gynecologist, Limi Hospital, Abuja. Who is a gynecologist? A gynecologist is actually a doctor that specializes in the care of women reproductive health issues. And when you look at it, that's a doctor that deals with problems in women that are not pregnant. We call doctors who are dealing with pregnant women obstetricians. In fact, that's just the simply put the difference between a gynecologist and an obstetrician. That's why a gynecologist has been trained to deal with issues that has to do with women reproductive health challenges, and at the same time those that deals with problems in pregnant women. And obstetrician, they deal with that, they take care of pregnancy, they deliver baby, and that's their job stops there. Thereafter, they continue to see a gynecologist. The same doctor actually can also perform the same role, but we specialize in different things. When we come to now the aspect of obstetrics and gynecology, we can have subspecialties, and that's where we major specializes in different aspects: fetal-maternal medicine, reproductive health, oncology, that is gynecological cancers. So these are different aspects of obstetrics and gynecology practices. Why do you need to see a gynecologist? There are various reasons why, as a woman, you need to see a gynecologist. One of it is if there is delay in conception, what we generally term as infertility. If you have been trying to achieve conception for a number of months, you've been trying for 6 to 12 months, you might need to see a gynecologist. Their advice will be very important in ensuring that you and your husband, you are able to achieve conception. Of course, if there is painful menstruation, what we call dysmenorrhea, you deserve to see a gynecologist. If you have heavy menstrual flow, irregular menstrual cycle, or your cycle, you are missing your cycle, you are having a longer duration of cycle length of your menses, you need to see a gynecologist. We need to find out what the problem is so that this can be resolved for you. Also, if you are having uterine fibroid, it's one of the common reasons why you need to see a gynecologist, because we need to know how to manage this and discuss this with you. Also, if you are having abnormal vaginal discharge, it is not good. Whether you are married or you are single, you need to see a gynecologist for proper evaluation and treatment in order to prevent complications that might even affect your menses or affect the chances of even getting pregnant in the near future. So this is very, very important. Also, if you have what we call gynecological malignancy, take for example, we have carcinoma, we are having endometrial carcinoma, ovarian cancer. These are reasons why we need to see a gynecologist, because this has to do with your reproductive health issue. This needs to be resolved for you. Also, when you are having even postmenopausal symptoms, take for example a woman that has stopped seeing her menses, which usually around 50-51 years of age, your menses is expected to stop. Some can extend even up to 55 years of age, and you're having issue coping with it, like hot flashes, you have that vaginal dryness, you're having sex and you're having painful menses, which is one of the things that is expected. You have to see a gynecologist for you to be taken care of as appropriate. Of course, it comes with mood changes too. These are the things that can be evaluated and can be worked on together with your gynecologist to improve quality of life. When there are these complaints, please visit a gynecologist.